Assalamu alaikum, viewers. I'm shayawu Mariam, and today I'm to talk about another health problem in our community. So, in case you're wondering what I'm going to talk about, this condition is a major cause of kidney failure, blindness, heart attacks, stroke, and lower limb amputation. And in the account settings, is being called a shayawu, which means sugar sickness or sugar disease. So a shayawu is, because I've already mentioned a shayawu, you know what I'm talking about, and you all know it's diabetes. So when we say diabetes, what is diabetes? It is a condition that affects how our body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood into your body cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream, and over time, this can cause serious health problems such as heart disease, vision loss, and kidney diseases. There are mainly 4 types of diabetes, and these include type 1 diabetes, type 2 diabetes, prediabetes, and gestational diabetes, which occurs in pregnant women. So I'm to talk about them one after the other because each type of diabetes comes with its own features. So let's begin with type 1 diabetes. Type 1 diabetes is an autoimmune disease, which means the body attacks its cells. In this case, insulin producing cells in your pancreas are destroyed. And in people who are having diabetes, up to 10% have type 1 diabetes. And this type was once better known as juvenile diabetes because it was occurring in children and teens, but now it can occur at any age. Doctors don't know exactly what causes this type of diabetes. Genes may play a role in some people, and it's also possible that a virus sets off the immune system attack. Symptoms of type 1 diabetes include extreme hunger, increased thirst, unintentional weight loss, frequent urination, tiredness, blurry vision, and it may also result in mood changes. You are more likely to get type 1 diabetes if you are a child or a teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. It can be managed through insulin therapy. Since your pancreas no longer makes insulin, you must take in insulin every day in order to survive. As at now, no one knows how to prevent type 1 diabetes because it's an autoimmune disease. Let's talk about prediabetes. Prediabetes is a precursor to type 2 diabetes. This occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. Prediabetes raises your risk of type 2 diabetes, heart disease, and stroke. If you have prediabetes, the goal is to keep it from progressing to diabetes. Many of the strategies used to prevent diabetes are the same as those recommended for the treatment of type 2 diabetes, which I'm to talk about in the video. So I'll just skip this part of the features of prediabetes since they are similar to that of type 2 diabetes, and we'll talk about type 2 diabetes. Type 2 diabetes is more common than type 1 diabetes because 90 to 95% of people who have diabetes have type 2 diabetes. This type of diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. Until recently, this type of diabetes was seen in adults, but it is now also occurring frequently in children. With type 2 diabetes, your body has a problem with moving sugar into your cells, but not because your pancreas stopped producing insulin. Your pancreas will produce the insulin alright, but your cells are insensitive to it and can't use the insulin the way they are supposed to. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese can increase your risk too. Carrying extra weight, especially in your belly, like what people call pot belly, and they think it's associated with being rich or having money or living a good lifestyle, makes your cells more resistant to the effects of insulin and how it takes up the sugar in your blood. So it's advisable to take control of your weight, especially your belly fat. You may not have any symptoms at all or may not notice them since they develop slowly over several years. Symptoms usually begin to develop when you are an adult. Your risk of type 2 diabetes increases when you are overweight, over the age of 45 years, have a parent or sibling with the condition, you are not physically active, you have high blood pressure, high cholesterol, and have prediabetes. And also those who have had gestational diabetes before are more likely to get type 2 diabetes. Diet and exercise can help some people manage type 2 diabetes. If lifestyle changes are not enough to lower your blood sugar, you need to take medication. Simple lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should achieve and maintain a healthy body weight, be physically active, doing at least 30 minutes of moderate exercise on most days, eat a healthy diet, avoiding sugar and saturated fats, and avoid tobacco smoking, which increases the risk of diabetes and cardiovascular disease. And now to gestational diabetes. It is high blood sugar during pregnancy. Insulin blocking hormones are produced by the placenta and causes this type of diabetes. It develops in pregnant women who have never had diabetes before, and if you have gestational diabetes, your body could be at a higher risk of getting type 2 diabetes, and your baby too will be having health problems such as being overweight or obese, and the risk of getting type 2 diabetes later in life. Most women with gestational diabetes don't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually done between the 24th week and 28th week of pregnancy. In rare cases, a woman with gestational diabetes will also experience increased test or urination. Your risk for gestational diabetes increases if you are overweight, have polycystic ovary syndrome, you are over 25 years, you've had a gestational diabetes before, or you have a family history of type 2 diabetes. Uncontrolled gestational diabetes can lead to problems that affect both the mother and the baby. Treatments for gestational diabetes include lifestyle changes, blood sugar monitoring, medication if necessary. Eating a well-balanced diet is important for you and your baby during these 9 months. Making the right food choices can help you avoid diabetes medications. A healthy diet focuses on fruits, vegetables, whole grains, and less fats and oils. If diet and exercise aren't enough, you may need insulin injections to lower your blood sugar. Between 10% and 20% of women with gestational diabetes need insulin to reach their blood sugar level goals. So some doctors prescribe an oral medication to control blood sugar, while others believe more research needs to be confirmed that oral drugs are safe and effective as injectable insulin to control gestational diabetes. So thank you for listening to my lecture on diabetes, and I hope we all take the appropriate preventive measures to protect ourselves from getting diabetes. Thank you very much.